Good morning. We'll begin the Board of Supervisors meeting with the work session with our county engineer, Anthony Bargett. Anthony, good morning.
Good morning, everyone. Well, I don't have a whole lot of new items to discuss today since our budget meeting last week, but just a couple informational items I just want to give you a heads up on. Tomorrow, we are going through our interviews with the two construction engineering consultant candidates that submitted for the RFP for the build grant project. We are going to be going through that tomorrow morning with our selection team, and Supervisor McDonough is one of the people on the selection team as well. So we're going to be doing that, and then scoring those two candidates, and eventually give an official recommendation to the board for approval. So that's taking place tomorrow. One other item, since the last time we discussed the CPCN railroad merger, we brought up the possibility of having some discussion at the DMATS board. So this Thursday is the DMATS meeting. I had some discussion with Chandra Rabata about what we could do for discussion points on that. The official window to, I guess, give official input to the merger is closed, but we still thought it's a good idea just to have some official or informal discussion at the DMATS board this Thursday. So that will be just a discussion item on the agenda for Thursday. Really nothing more. There's no action taken from that. It's just kind of put all our heads together and see what, just where our thoughts are with that. So that's happening this Thursday. Beyond that, I guess, do you guys have any questions for me on anything?
I don't have anything, Jay.
Anthony, who are the two engineering consulting firms that applied?
Origin Design and Bolton and Mink.
Okay, thank you.
Mm-hmm.
And do you have anything?
Anthony, I wondered if you could give some input into the last weekend at Sundown Road. At Sundown, they had an event that they had insufficient parking for. And so we had cars parked along Asbury Road, illegally parked. The sheriff was called. I don't know, in my conversation with Sheriff Kennedy, it seemed another type of thing like the Orchard, where, I'm delighted that they have success, but their planning for the success is not keeping pace, I guess. So I wondered if you were you aware of it? Do you have any thoughts about it? I don't know where Asbury's boundary is. I think it's the middle of that road.
Yeah.
So Asbury wasn't involved, although they were contacted too.
I think Asbury has the center or the south lane out to Sundown Road. So they own the south lane there. I was not aware of it, so no, this is the first I've heard that. I know we've had a couple instances, a time or two. I think there was a motocross, or not the motocross. So I forget what you call it. Anyways, it's the snowcross.
Mm-hmm.
There was that event. I think there was some some traffic issues. So it seems like it's been kind of spotty over time. Doesn't seem like it's been real prevalent, but maybe it's starting to pick up a little bit. And but again, I wasn't made aware of it from this weekend.
Okay, thank you.
All right. I have nothing else. I didn't get out to Woodford's Road yet either. I wanted to get out there this weekend and never made it out there to look at that, Anthony, but that's nothing we're going to do right away anyway. So
No, and if you want to connect with me and go out there, just let me know.
all right. Yeah.
Other than that, I'll be working on the construction program plan, I guess, over the next couple of weeks. So in probably early March, I'll be looking to submit that to you guys and give a presentation, a public hearing on that. So that's kind of my next step of things to work on.
Okay.
Pretty boring today.
Anthony, just a general question. A few years back, you and Tammy took over the modifications of the driveways, the entrances.
Yes.
Is it possible for you to just, I mean, maybe you can do it now, but just let us know how that process is going? Numbers, I mean, we've never seen, nobody's ever further appealed to us. So it must be going well, or, you know, what do the numbers look like?
Yeah, I think we've had the similar numbers, same kind of numbers that used to come before you guys in the years past. So very average number of entrances still coming in. We've been able to analyze them and I think give good intelligent decisions to the site distance and spacing. Spacing, we give a little more lenience to if there could be a trade-off from getting rid of another driveway or whatever the circumstance might be. Site distance is where we don't have a lot of leniency towards that, but we haven't had a whole lot of problems with that. My opinion is still if somebody wants to contest a denied driveway permit that's denied based on site distance, that will still go to the Board of Supervisors for final approval or final disapproval or denial. But we really haven't had too many of those. I think maybe one that we've sent up to the board level. So it's been, I think, a pretty efficient, successful process.
Thank you.
If nothing further for Anthony, or
Nothing.
Motion to recess till 9 a.m.
Second.
have a motion and a second to recess till 9 a.m. All in favor signify by aye.
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 Thank you, Anthony.
Thank you, Anthony.
Yep, thank you.
Good morning. We'll call the Board of Supervisors into session for February 7th, 9 a.m. meeting. This time, anyone may address the board on matters of which are on the agenda. Please go to the podium, state your name and home address. Individuals wishing to comment on a public hearing will be given the opportunity during that respective hearing. Individual remarks are limited to 3 minutes. Do we have anyone in the boardroom that wishes to address the board? No one in the chambers? Do we have anyone online?
We do not.
Okay, we'll move to the proclamations. We have a proclamation honoring the memory and legacy of Captain Robert L. Martin, which will be read by Supervisor McDonough.
Good morning. The proclamation. Whereas Robert L. Martin was born in Dubuque on February 9th, 1919, graduated from Dubuque Senior High School and earned a degree from Iowa State University. And whereas Robert Martin graduated from the Army Air Corps Tuskegee Flight Experiment and received his wings as a fighter pilot on January 7th, 1944. He was assigned to the 100th Fighter Squadron, a part of the 332nd Fighter Group, assigned to the European theater operations. And whereas the elite Tuskegee Airmen were dedicated, determined young men who volunteered to become America's first Black military airmen and broke racial barriers to become the most respected fighter group in a segregated military that previously never thought Blacks could fly planes in defense of their country. And whereas the Tuskegee Airmen were called Red Tails because of the crimson paint on the tails of their P-51 Mustangs, and are renowned for their documented 1,578 successful missions, during which they maintained one of the lowest loss records of all the escort fighter groups. And whereas Robert Martin was originally commissioned a second lieutenant and rose to the rank of captain, Captain Robert Martin's legacy is to be shared and remembered for generations to come with the naming of the Captain Robert L. Martin Terminal at the Dubuque Regional Airport in his honor. And whereas a celebration will be held for Captain Robert Martin's birthday at Dubuque Regional Airport on Wednesday, February 9th, 2022, from 3:30 to 7. Now therefore, the Dubuque County Board of Supervisors, on behalf of the staff and citizens of Dubuque County, do hereby recognize the birthday of Captain Robert L. Martin during Black History Month in Dubuque County, Iowa, and urge all residents to further affirm the rich stories of local heroes. Proclamation adopted the 7th day of February, 2022.
I will make a motion to approve the proclamation.
I will second it. Have a motion and a second to approve the proclamation. All in favor signify by aye.
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 Hi, good morning. I'm RRS Stewart. I'm treasurer of the Captain Robert L. Martin Commemoration Committee. We'd like to thank you for the proclamation. We also have Todd Dulcing, who is the director of the Dubuque Airport, here with us. And we would like to thank you and invite all three of you, and of course, anyone else here today, to come out to the airport for Captain Robert's birthday celebration on Wednesday. His daughters, Gabrielle and Dominique, who you met remotely when you did this proclamation last year, will be there in person at 5:30. So you'll get them a chance to meet them in person on Wednesday if you want to. Thank you again.
Thank you.
There you go.
Thank you.
Moving forward, we'll go to the approval of the minutes of meetings of January 26th, 2022, which is a budget meeting, January 31st, 2022, budget meeting, and January 31st, the actual board meeting.
I'll make a motion to approve the minutes of the meetings as presented.
And I will second that.
I have a motion and a second to approve the minutes as presented. All in favor signify by aye.
Aye.
Aye. Carries. Next, we have consent items. We have an amendment to the Bishop Winery permit to include outside service.
I'll make a motion to approve the consent items for Bishop Winery.
Second.
A motion and a second to approve the amendment to the Bishop Winery permit. All in favor signify by aye.
Aye.
Aye, that carries. Next, we go to procurement procedures. Have a notice to bidders, HMA paving, culverts, revetment and shoulder widening on Old Massey Road project lost 23 parentheses 01-73-31.
I'll make a motion to approve the notice to bidders.
And I will second that.
Have a motion and a second to approve the notice of bidders. All in favor signify by aye.
Aye.
Aye, carries. Next, we have a notice to bidders, HMA resurfacing and pipe culverts on Rockville Road, Old Worthington Road, and Old Farley Road. Project LFM-P23 parentheses 3-7X-31.
I'll make a motion to approve the notice to bidders by 3 p.m. on Friday, February 25th.
Second.
Have a motion and a second to approve the HMA resurfacing for Rockville and Old Worthington. All in favor signify by aye.
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 Aye, carries. There are no public hearings for this meeting. There are no plats for approval this meeting. Next, we'll go to the action items. Have a resolution to authorize the chair to sign Intech Software Solutions Incorporated contract. I believe we have the auditor here for more context on that.
Good morning. This is Auditor Dragato. This resolution is to authorize the chair to sign the contract for a piece of software called Modus, which will help us manage elections anywhere from poll workers to also cataloging equipment and monitoring where equipment is. Another key component it will allow us to do is to offer online training down the road for our PEOs, which we think will help us recruit more because they won't have to block out entire portions of the day down the road. That'll be a work in progress. Total cost for the software is $10,730. We secured a $10,000 grant from the Secretary of State, and they have authorized Modus as an appropriate use for that grant. So I would recommend approval of this resolution, please.
I'll make a motion to approve the resolution authorizing the chair to sign the Intech Software Solutions Inc. contract.
And I will second that.
Have a motion and a second regarding the Intech software. All in favor signify by aye.
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 Aye, carries.
Thank you.
Thank you,
Job getting the
Kevin.
grant.
Next, we have a resolution to approve the necessary right-of-way documents for the HMA paving, culverts, revetment, and shoulder widening on Old Massey Road project lost -23 parentheses 1-73-31. Believe it just
I know we've
deal-
got a couple as Anthony on the line just to give us a little context.
Yes, good morning. We just needed a little bit of extra right of way along Old Massey Road to facilitate the pipe replacements and some shoulder forest slope widening. So not a ton of right of way, just a little bit to do those improvements along the road.
That's just for a total of like $1,270, correct?
Yes, that's correct.
Okay.
I'll make a motion to approve the right-of-way purchase for Old Massey Road.
Second.
Have a motion and a second to approve the necessary right-of-way documents. All in favor signify by aye.
Aye.
Aye, carries. Next, we have a resolution to approve the necessary right-of-way documents for the HMA resurfacing and pipe culverts on Rockville Road, Old Worthington Road, and Farley Road, project LFM-P23 parentheses 3-7X-31. Anthony.
Similar scenario on this road as well. We just have some shorter pipes that need to be extended, so we needed a little bit extra right away. So yeah, this one's 0.111 acres for a total of $1,188.
Okay.
Make a motion to approve the resolution.
I will second that.
I have a motion and a second to approve the necessary right-of-way documents. All in favor signify by aye.
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 Aye. Carries. Next, we have a resolution to approve the plans and specifications for the HMA paving, culverts, revetment, and shoulder widening on Old Massey Road, project lost -23 (1-73-31).
This would be for paving of Old Massey Road from the Mines of Spain Road down to Massey Station Road. It's about 2.49 miles. This would be an HMA paving project, culvert replacements. We have a box culvert extension we're going to be doing, and some shoulder widening and erosion control with riprap. So kind of an all-around project on this project.
Okay. Any questions for Anthony?
I'll make a motion to approve the specifications for Old Massey Road project.
Second.
Have a motion and a second to approve the plans and specifications for the Old Massey Road project. All in favor signify by aye.
Aye.
Aye, that carries. Next, we have a resolution to approve the plans and specifications for the HMA resurfacing and pipe culverts on Rockville Road, Old Worthington Road, and Old Farley Road, project LFM-P23 (3-7X-31). Anthony.
Okay, this would be HMA paving or resurfacing and pipe replacements along Rockville Road and Old Farley Road. And Old Farley Road actually turns into a little section of Old Worthington Roads that all kind of combines together there. This would be a total of 9.85 miles. So that's pretty much it.
Thank you, Anthony. Any questions or discussion?
I'll make a motion to approve the resolution.
And I will second that.
I have a motion and a second to approve the resolution to approve the plans and specifications for Rockville, Old Worthington, and Old Farley. All in favor signify by aye.
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 Aye, that carries. Next, we go to communications. There are no communication items for approval this meeting. Moving on, we go to appointments, open vacancies for information only. On to the Prairie Creek Township trustee, Virgil Weber, put in an application.
I will make a motion to accept the application for Virgil Weber, Prairie Creek.
Second.
Have a motion and a second to appoint Virgil Weber to the Prairie Creek Township trustee. All in favor signify by aye.
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 Aye. Next, another Prairie Creek Township trustee, Steve Freiberger.
I'll make a motion to approve the appointment of Steve Freiberger as trustee for the Township Prairie Creek.
And I will second that.
Have a motion and a second to appoint Steve Freiberger as a Prairie Creek Township trustee. All in favor signify by aye.
Aye.
Aye. That motion carries. Next, we have Jeff Schmidt as trustee for Peru Township.
I'll make a motion to approve Jeff Smith as the trustee for Peru Township.
Second.
Have a motion and a second to appoint Jeff Schmidt as a Peru Township trustee. All in favor signify by aye.
Aye.
Aye, that carries. Moving on to personnel requisitions. There are no requisitions for approval at this meeting. We'll go to the public comment section. Again, at this time, anyone may address the board on matters of which are concerned to that person and which are not agenda items. Please go to the podium, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Do we have anyone in chambers wishing to address the board? Do we have anyone on Zoom wishing to address the board?
We
Yes.
do.
Go ahead, Danielle, is it?
Yes. Hi, I'm Donnell Gordon. I am the chair of the Captain Robert L. Martin Commemoration Committee, and I want to thank the board for honoring his memory and legacy today with the proclamation. And I appreciate the board's support in the project for the naming of the terminal after Captain Martin at the Dubuque Regional Airport.
Okay. Thank you, Donnell.
Thank you.
Is there anyone else wishing to address the board?
I have nobody else.
That would wrap up everything on the agenda. Next, we have a work session at 9:45 for COVID update. Looking for a motion to recess till 9:45.
Make a motion to recess until 9:45.
I will second that.
Motion and a second to recess till 9:45. All in favor signify by aye.
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 Aye. We are in recess. 9:45, we'll call the Board of Supervisors back into session. We have a 9:45 COVID update. Samantha, our intern, Board of Health Director.
Good morning.
Welcome. Good morning.
Okay, yep, I'm just here for a quick COVID-19 update. You can go to the next slide. So this shows our community transmission level. In Dubuque County, we are still at high, which we have been at for many months now. And like I reported last month, every state in the country is currently at some level of high community transmission. And just a reminder, when we are at a high level of community transmission, the CDC is still reporting or still recommending that we wear masks in public, whether we're vaccinated or unvaccinated. This is a review of January, our variance by month in Dubuque County. And IDPH estimated that 95.9% of all of our positive COVID cases in the county last month were Omicron. The other 4.1% they are estimating as Delta. And this again comes from sequencing a certain number of positive tests that come into the state hygienic lab to get that estimation for the county. And for January 2022, it's estimated that 93.2% of all positive cases in the state of Iowa were Omicron. So we're slightly higher than the state's estimation, but still pretty close. There's no variant data for February yet, but as you can tell from this graph, it is in Dubuque County and still spreading. Okay, this is another slide for January review. It's our positive COVID cases in Dubuque County by age, just from January 1st to January 31st. And this is a similar trend, like I've been saying the past few slides. We know that children 39, or young adults and children 39 and younger are still making up the majority of the positive cases we're seeing in Dubuque County. This is a snapshot of Dubuque County right now as it relates to testing. 2,037 COVID tests have been completed in the last 7 days in the county, and 277 of those tests came back positive. Like I said, individuals 39 and under are making up 57% of all those positive cases in the last 7 days, and that trend has stayed the same for quite a few weeks now. And then I want to talk about the last bullet point on here. Total positive COVID tests reported in the last 7 days is 460. And what we've noticed through our DOMO program is that there's a discrepancy between those two numbers, the COVID tests in the last 7 days and COVID tests reported in the last 7 days. And we've noticed that for a while, it's just that the number has usually been smaller and they've been closer together. But because of the high number of tests that are coming to this state hygienic lab, the lag time in reporting has gotten even bigger. And so that discrepancy between the two numbers has been big as well. So for example, last week, it was reported that our past 7 day total was over 1,000. And that wasn't necessarily everyone testing positive in the last 7 days. It was the tests reported in the last 7 days. So some of those tests included in that 1,000 count were people who got tested, some even back in December, but their positive wasn't reported until that past 7 days last week. So that is why we have the difference in numbers, and it is creating concern for misreporting or information. I still think both numbers are important. It just depends on what conversation we're having. But as you can see from the next slide, our second peak is still high, and that's continuing to grow. And I think that's because the backlog of tests are getting added into this table. So that peak continues to grow, but it's still showing that we're at a decrease right now overall. This is a snapshot of our vaccination data in Dubuque County. 69.8% of our 5 and older population has either completed their vaccination series or is currently in the process of completing that. And for 65 and older, we're at 97.4%, which is great. Of those who are eligible to get a booster, we are at 55.7% who are now up to date, which means they've completed their initial vaccination series and now have their booster. Again, those who are eligible, 29 and younger, are making up our lowest amount of boosted vaccinations, which, like I said before, is very similar to the age group that's making up our highest number of cases. And this is a January review slide showing our completed vaccinations by month. As you can see, in January 22, we completed 958 COVID vaccinations in Dubuque County, which is slightly less than December, but still staying pretty consistent with the past few months. I have been talking with the VNA, and last week they let me know that out of all the vaccination clinics they've had, they have yet to have one where a single person doesn't show up for a vaccination. So that's great news too. There's still people out there in the community getting their single dose as well as their booster. This is just additional COVID-19 updates as of today. And since the last meeting, our incident management team has changed our approach to contact tracing. On January 21st, 2022, we stopped traditional contact tracing efforts and shifted more toward increased education on isolation and quarantine, as well as staffing a COVID-19 hotline to answer community questions. And since then, the VNA has received 102 calls through the hotline that they've been able to assist community members with their isolation and quarantine guidelines. And then these are 2 posters that we created that have gone out to our testing providers and are distributed to community members when they receive a COVID test. The bigger one goes into detail about the difference between isolation and quarantine as it relates to the newest guidance. And the smaller one is a QR code that will take you directly to the poster site where we can also see that guidance as well. And additionally, last week, we know that Governor Reynolds announced that the state's official disaster status for the COVID-19 pandemic will expire next Tuesday. Along with this will come some changes in the COVID-19 data reporting and information sharing on their vaccine and coronavirus websites. But as of right now, the incident management team does not plan on stopping or changing any of the local mitigation efforts that we've instilled over the past few months. But with all of these changes, specifically those related to the data reporting, the incident management team is currently having conversation about what our reporting will look like moving forward. So I'll have a lot more to share on that in the coming weeks as we see changes to the IDPH public dashboards. And one more point to that, some things that won't be reported by IDPH anymore are long-term care facility outbreaks, and that's because they're already being reported elsewhere. And negative test results. And the reason for this one is that negative test results are not required to be reported for any other acute infectious disease. IDPH does still plan on reporting positive tests, variant data, COVID-19 death-related data, and COVID vaccine data. And in October of 2022, all of this information will be included in the annual influenza report. And it seems as though that's the shift IDPH is taking, where we'll see that on an annual basis through the report. Like I said, there will be changes to the COVID and vaccine state dashboards, but we will still be able to see a lot of this data on Domo, but that's only accessible to local providers. So we're currently working out a plan for what we want to present to the public moving forward after these changes are made. But that's all I have for this update. We do have a Board of Health meeting next Wednesday where I can present more data or follow up on any questions that you guys have today.
Jay, do you have anything?
Thank you for being here. Appreciate it. Can you expand a little more about what local reporting will have post the state of Iowa and their decision related to reporting? What will be either new or different?
Yeah, like I said, the incident management team is making a plan for that now. I really don't think that you're going to see much change in what we're reporting, like in these PowerPoint presentations that we've done every month to the Board of Supervisors and Board of Health. What will be different is that the public might not have access to the information we're sharing on a daily basis. So, you know, the incident management team wants to stay as transparent as possible. And we understand that that's going to create maybe an issue with that for those who are following the public dashboards every day. But I right now don't think that there's going to be much change to what the incident management team is reporting.
So there'd be very little effect from the governor's ending the proclamation other than in the reporting then?
That's my understanding right now. Yeah.
Ian, did you have anything?
Certainly seem to have inconsistencies.
Yeah.
You know, I can see Illinois.
Yeah, we've been trying to work through that. We understand the confusion and the complications related to having two different dashboards like that that aren't reporting similar numbers. Especially last week when we saw that 1,000 cases were reported publicly, but we were seeing a very different number on Domo. But now that we've better understood why there is that difference, we feel more confident in reporting those numbers. And it's just making sure that we report them in a way that's understandable to the general public so that we get a good picture of what Dubuque County is actually looking like right now.
So when I picked up my grandchildren from their daycare provider on Friday, for the first time in several years, I was invited to come into the building and go to their classroom. And I wore a mask because I do, but no one else was wearing a mask. Is that really where we are? That it's just all back to the way it was before this all began?
I don't want to say that. I think that what we're hearing from IDPH and what we're hearing nationally is that people are starting to move toward this becoming an endemic. And we know that's the natural course for pandemics like this. But I hesitate to call it an endemic just yet because I would feel more comfortable seeing those numbers go down more before we start moving that direction. And like the first slide show, we are still at a level of high community transmission. And so the CDC has not changed their recommendations on that, which include social distancing, wearing a mask, regardless of vaccination status when out in public. So I personally recommend that we continue those efforts until we learn more information, but I understand where you're coming from. And I think there are a lot of people in the community leaning toward that right now.
Do you see a time when your recommendation, like you're wearing a mask today, and I appreciate that, but is there going to be a time when that's not your recommendation, regardless of what the CDC says?
I think the incident management team and the Board of Health are going to continue sticking with CDC guidelines. But I do believe that on the next Board of Health agenda, there will be a conversation about what our recommendations are right now and their plan moving forward with that. But as we have in the past, I think that it makes the most sense for us on a local level to stick with what the CDC is recommending.
Thank you, Samantha. I appreciate you coming here and answering questions and presenting the information that you have.
Thanks. Yeah.
Thank you very much, Samantha.
Wait, one last question or point. So just for clarification, so you envision between the Department of Health, Board of Health, and the incident management team that post February 15th, there will be reporting of positivity rates and hospitalization rates?
Yes, we should still be able to see those on our Domo dashboard, so I don't think that will change.
So you'll be able to present those locally.
Yeah, and along with that, we still meet with our healthcare providers in our hospitals on a weekly basis, and meetings like those are not going to end come February 15th either.
Very good, thank you.
Yeah. Any other questions?
I have nothing. Thank you very much, Samantha.
Yeah, thank you. Have a good day.
We have a couple minutes before our 10 a.m. work session with city manager.
So I did have a question on that agenda item and maybe a request in the future, if we could be a little more specific. So city manager discussed 28 agreement is pretty general considering that could be a lot of things. So just a request.
It has to do with
And I'm still guessing at this moment.
it's with the dispatch.
That was my guess. But I prefer to have it just called out on the agenda if we could.
How do you want to have people participate? Where will they be so we can hear them?
Put everybody up front or participate, I guess. Think Tom is out there yet. We'll go to our 10 o'clock work session with Dubuque City Manager Mike Van Milligan, Tom Berger, and Joe and Murph, I'm guessing, want to be part of this? Right up here. Good morning, Mike. Good morning, Sheriff Kennedy. Good
Good
Morning.
morning, all. Morning.
Good morning.
morning, Mark Murph.
Morning. Are the microphones on, Kevin?
It's been a while since we've tried these microphones, so good luck.
Yeah, well, it's good. Glad to hear the pandemic's over, so.
Not what she said. Didn't say that.
This work session is to begin to the conversation regarding the 2080 agreement with the city and the dispatch center.
Bring that back. I didn't bring enough.
You're good.
Where would we like to start, Mike?
Well, I appreciate the invitation, first of all, to open up the dialogue. What Mike Van Milligan, city manager, I'm not sure how your system works here, so
No,
I know we have to introduce ourselves. I appreciate the invitation to open the dialogue. People might remember that pre-COVID, we were having discussions about this issue, and then COVID kind of shut everything down. So I did have some information that I brought with me that I'd like to share.
Is the same? Cool. Okay, thank you.
And the crux of the issue for us as the city, when we began these discussions now several years ago, revolved around basically three things. One is, I think by everyone, that we, being good stewards of the public's safety, that we should give consideration to having a different location for our 911 emergency communication center. It's in a floodplain. When you're on the Mississippi River, that's a real floodplain. They're not kidding. And the fact that it probably could use some modernization. And also there's other kind of disasters that can happen that where it currently is at and the way it's structured, it's probably exposed to. And so there's been discussions for a very long time about we probably ought to see if we can figure out how to get it somewhere else. So that's one of the issues. The other issue for us, governance. So when I started here in January '93, I remember Pauline Joyce was the administrative services manager for the city of Dubuque. And I asked her why we ran a countywide 911 center. And it was a pretty long discussion about politics. And so I don't know what the politics were like before I got here, but it seemed like when it was put forward that this should be created, and I don't remember the year it was created, that there was a struggle on agreeing of how it should be run. And however the compromise came out, it was decided the city should run it. I personally don't think that's a good governance model. And one of the handouts I brought today tries to show what the different levels of governance boards exist on a countywide basis. And as I look at these, I have a lot of faith in the people that are serving on these boards. You know, in one case, it's the elected officials from all the communities in the county, across the county, to deal with emergency issues. In another case, it's what I'll call the professionals that are dealing with it. And in many cases in the county, those are volunteers, but they're still professional and they still have training and they still live this every day as they volunteer. And so I have faith in that. And then through the 2080 agreement, which created this situation we're in today, there was this 5-member public safety committee, which was created, which now consists of Sheriff Kennedy and the Dyersville Chief of Police, Brent Schroeder, and the Dubuque County Fire Association representative is Dan Neenan. And then from the city of Dubuque is the Dubuque Fire Chief, Rick Steinis, and our acting Dubuque Police Chief, Jeremy Jensen. I certainly have a lot of faith in that group to make good decisions about how we deliver emergency services across our county. And I say our county because I live here too. And so I think that that's my other issue, is the governance issue. I don't see a reason why this is governed by the city of Dubuque, and the way the council manager form of government works, it's basically the city manager's responsibility. And of course, I achieve that through Mark Murphy, who's the department manager that runs the department. And then the other thing I would point out is on the second page of that smaller handout, there's the little pie charts on it. The third thing is the funding. So when it was agreed that this would be established the way it is, it was the city would pay 2/3 and the county would pay 1/3. First of all, I think that's a formula that's dated, but regardless, it is the formula. And you can see at the top of that page, if that was working appropriately, that's how it would work based on current expenditures. But it doesn't. It works the way the bottom pie chart shows, because the city puts our portion of our 2/3 on the city of Dubuque property taxes, and the county puts your 1/3 on the county taxes. And since the residents of the city of Dubuque County, they pay both. So what it ends up being, city residents of the city of Dubuque pay 86% of the cost, not 2/3 of the cost. And the residents outside, the county residents outside of the city limits of the city of Dubuque pay only 14%. So that doesn't seem equitable to me either. And then the other handout I gave you goes back to the governance issue. This is just one example. It's Johnson County, the Iowa City area, is how did they establish when they created a center? And they used a governance model as I described earlier, where they put the faith in the professionals that deal with these issues. And also they use a funding model that is where the funding is spread across the county through, I believe it's through their EMA levy, which is a county-wide levy. And so everybody only pays it once instead of their major city residents paying it twice. And while I don't know if this is the exact model to use, I know it is a model that appears to work and I think is more in line with the way it should work in Dubuque County. So appreciate the invitation, and those are my thoughts on it.
I appreciate you coming, Mike. Obviously, I have discussed this issue with you previously, and we are looking at space needs for the county. I understand that the city property owners are paying more, and I think it's got to be fair among everybody. And I think the EMA levy may be the way to go, where the county would be able to take it over and everybody be treated fairly. City, county, whatever. We have quite a ways to go to, if we can find a space for the dispatch. I mean, there's a lot of moving parts that have to fall into place, but I wanted to get this conversation up front and at least start the dialogue to see how we can make this work. Yes, we do have Stella here. What would the levy look like for, I believe it was like 1.6 million for everything, right, Mike?
Yes, and of course, you're already levying about, I think about 600,000 of that fund. Got my numbers right?
I want to say it's 525, Mike.
525. Stella would know.
So currently we are levying about 525,000. We're spending it out of our general basic fund. In order to do a switch like this, it would need to come out of our general supplemental fund. And that would be about 30 cents to that fund.
Okay.
And Stella, what's the change in the levy due to the mental health being taken off there?
It's about 39 cents coming off from mental health.
My question is this, Stella, is there such a thing as an EMA levy? Let's go big and high.
Sure.
How do we
So-
explain this to citizens?
There's not an EMA levy. I reached out to Carrie Johnson at Department of Management to see how this would work. And it's increased to the general supplemental levy. So I believe, excuse me, you might be able to call it out separately, but it is not a separate levy.
It's listed on the tax bills as an EMA, emergency management levy. So
Right, it would be
but
a
it
build
does come
out.
out of your general supplemental.
It'd be a build out of the supplemental, but it would show
I'd have
the
to,
owner, I would know what I'm paying to the EMA is
Right.
to that levy or not.
I would have to talk with Carrie about that to see how we would do that.
They didn't want citizens to know how much is going to the EMA levy.
Yep, that's the way I understand it. All the other counties have it.
All right.
In fact, if they have a tax bill, I think it shows on there. I would think it's standard, but we just don't have anything on our Dubuque County tax levy or tax bill.
So what is the significance of having it be spelled out for everybody?
I just think it would be transparent that you look at your tax bill, you know how much is going to the EMA. Emergency management, everybody'd be paying the same at that point. Right now, city property owners pay their city tax and they pay county tax. So they're paying twice, and county property owner, you're just paying your county tax, so you're paying once. It's not fair. Not that I want to raise taxes in the county, but we have to be fair to everybody. People living in Dubuque are county residents, just like the people in the county are. I think it needs to be fair across the board.
I think, Ian, on the, when they changed the legislation and they added in the 29C, as far as the funding mechanism, there's a couple things that changed, and this was driven by both Johnson and Scott County at the time, because they were the first ones to use that. And there was also a change in the way emergency management commissions could be funded. It used to be, there's 5 of them, 5 funding sources listed there, but it used to say the county supervisors may. And when they switched that to shall, this all came about, and the supervisors at the ISAC affiliate wanted to make sure that it was listed out to show, kind of take the heat off the supervisors, showing that it's for emergency services and emergency management. So that all kind of changed at that same time. So. And that's also the same time when our emergency management budget changed, where the supervisors affiliate did not want non-elected officials setting tax levies or, approving our budget. So that's why we have the annual meeting, in Epworth with the elected officials.
Okay.
Well, I'll start with the good news, at least from my seat. It appears that the 911 and EMS system we currently have works well for the citizens. Seems to work well for the stakeholders, and that'd be police department and sheriff's department, and then other remote rural providers. And so congratulations, Mark, and your group. You seem to answer the phone very well, and it seems to then get dispatched, and we seem to help the citizens, which is the core function of government. So That I'm very thankful for. Thank you.
I believe the 160,000 calls last year that dispatch handled.
165, yeah, phone calls.
They're pretty busy. And they're in very tight quarters. Any other questions, comments?
Well, maybe just a, observation. It's a pretty basic one. So City of Dubuque has a police department. And those residents also are taxed with county levy and city property taxes. That seems to work, seems to be a needed function. You also have a parks department. That seems to work and have a good area. You have in a finance department. We kind of have all those same things too at the county. And we're not looking, the city's not looking to remove those. And I would assume if you ask the citizens, they'd go, well, because they're needed. And that's kind of what I'd go back with this arrangement, is that the reason that it works well and the reason that we have such a good and robust 911 and emergency management system throughout county is because it's needed. And then I'll go back to the pat on the back, it works well. So for my seat, I don't see interrupting that. There's modifications. I think the formula you talked about, city managers, is right. It's probably a little bit off. 1/3, 2/3 set up in the 70s. Most of the growth has been in the county, and so it's probably closer to a 60-40 split. So I can see modifying that, but just changing the entire funding mechanism and management seems to be unneeded at this time, at least from my seat.
Well, we wouldn't be changing funding on. All we're doing is dealing with the dispatch center. The city, police, parks, all that are not included. No, we're just dealing with taking over the dispatch center, and it would be funded equally, through the county. The city police and everything would still be on their tax rolls. Obviously, county conservation, our stuff is still on our tax rolls, the sheriff's office. But the dispatch center, which is where the issue is, where there's confusion, I feel. Ann, do you have anything?
Yeah, I do think that the county citizens, all of the county citizens, they appreciate that the system works, right? When I try to talk to citizens about this, folks feel like they get lost in the weeds. They don't quite understand what are the high points, what makes this unfair. All they know is that it works, and they're very, very appreciative of that. And they really don't want us to mess that up. And so I think in my analysis of this, I think we need to be able to discern and then explain what is the need to make change. Why is the system needing to be changed? Why do we need to go down this road? At the same time that we talk about the modernization and the floodplain, we also have our county folks who are experiencing retention issues. City of Asbury, are they going to need to have professional full-time people? I mean, I think to say that this works for everybody isn't, it works because the phones are answered, but it isn't really reflecting the way the county has grown to be, the way the need for services is distributed. I think that, Tom, other fire chiefs have told me they're very comfortable with you managing this, and they wouldn't mind having more management authority. Our smaller communities would appreciate that. They know you, they work with you through volunteer fire efforts, emergency management, the city knows you. So as we try to make change and growth, that is a vehicle for this. So I'm not uncomfortable with having it run under Tom. It seems like that's what the code anticipated as well when it changed the language to shall. The supervisors are intended to do this very thing. So, why now? I think because we realize that we need to make some changes. It's not an easy thing to shift a tax from one taxing authority to another. That's very frightening, right? How do we make that work in our budget? Ultimately, I think we can do this and not increase the levy rate at the county, the levy rate that citizens have been accustomed to paying. It should still come in under $10 across the whole levy rate. I think that's possible. Wouldn't you agree, Stella? There's room to do that.
I would say that's pretty hard to say right now. I think we'd be back up around $10 for sure, because while we are losing 39 cents to mental health this year, we have been running sup low because of that flip-flop between the mental health funding. So over the course of the last 4 years that I've been here, there has been changes at the state level with the mental health funding and the fund balances and the requirements. So we have moved sup levy up and down to balance the mental health levy and keep our levy moving downwards. We've had fund balances in our general sup fund, but those are dwindling as well. So we'll have to normalize our sup levy at some point, which is closer to most of that mental health levy that is coming off. So a good portion of that will need to go to sup just to fund our own operations today.
So in anticipation of today, have you run any numbers looking at what the levy rate can hold in general sup?
I have not had a chance to do that yet. I received some information from Jenny Larson at the city last week asking about what would it take for about $1.6 million. That's the 30 cents. It would take about 30 cents in our sup levy. She also asked about the mental health levy. So that's 39 cents coming off, and also our backfill that we're losing. So that's another big piece of legislation that we need to keep in mind. While we do lose that over 8 years, it's about a 17 cent hit to the levy in total. So we will be losing, $500,000 of funding, $400,000 of funding in our general basic. And then the rest spread across the other funds as well. So those are things to just high level things to keep in mind as you work through this.
In high level, the reductions in our levy overall have come from our general sup.
Correct.
So our general basics capped at 350. We don't get general sup if we don't cap up. So that's where the reductions have come. Now, granted, the mental health is another state reduction that has occurred. But in my seat, I've spent a lot of time and energy reducing our levy. It'd been stuck at 10 for a couple of decades. And the other good news, just another good news in addition to, I think, this running well, is generally speaking, I won't speak for the city, but the county is in a very good financial position. So with American Rescue Funds, with the development we've had in the Highway 20 corridor, both commercial and residential, are both new developments, new valuations, and increased existing evaluations are all trending positive. Good news, real good news. So our fund balances are good and healthy. But this would be a significant change in that. This would be a reversal in the direction that I was hoping that the boards would continue to work with in reducing the overall levy. And then the last thing I'll kind of mention is that, we talk a lot about partnerships, and I've been hit a few times. I know, Jay, you should play nicer. This is an example of a good partnership. This is an example where you get the two largest government entities in Dubuque County working together, collaborating both financially, fiscally, and operationally. And from my seat, it works really well. So, where's that partnership talk I always hear about? Why can't we just keep the partnerships going? Because the next one we have is the, Dubuque Metropolitan Solid Waste. That's also a 2080 agreement. And so that's a partnership. I don't hear anyone else saying disband that partnership. And we just signed a new partnership with our watershed group. So far, so good. So to disband this partnership just seems counterintuitive to me when things seem to be going well.
I looked at from the high level. I don't want to raise taxes by any means, but I also feel we have to be fair to everybody, and the city is paying a lot more into this than what the county is.
True.
And I think it would be advantageous for the county to take it over that everybody is treated equally, fairly. Everybody pays the same for it. You know, for your dispatch services. It works great. There's gonna be no change in service. It's just gonna be a change in who's funding it per se.
There would or may be a change in management or government oversight, correct? Or is that up in the air?
Well, it'd
We would
be,
have still
Murph.
have the
Mr. Murphy would still be in charge of it. It'd just be the county would
Public
be
Safety Committee.
levying the funds to pay for it, because we obviously tax city property owners too.
Mr. Murphy, who do you report to today? City manager.
Correct.
So I would assume that the county was paying all of it.
Right,
We would not continue to have the city manager. be
Right,
the
right.
direct
It'd be a
report.
county
So there
entity.
would, yeah, there would be changes.
Right.
There would be changes in management and structure. And the one thing I've noticed is the city of Dubuque tends to run things very well. They seem to be very well organized, very well run.
The nicest thing you ever said to me, Jake.
But I'm glad it's on the record.
Question, please. Sorry, Stella. The 30 cents on the supplemental levy, if this were put on that comes in companion with the reduction of about 10 cents, right? So it's really a net change of about 20 cents to the levy.
Reduction of which levy?
Well, what do you
Sorry.
call that? The general basic levy is what you
So-
now levy about 10 cents to fund
So-
your third?
Unfortunately, no, because general basic has to stay at 350. So in order to levy general sup, we have to be at the max on general basic all the time. So that will always remain 350. We won't be able to reduce that levy rate ever.
Well, then you wouldn't have to raise the sub 30 cents then, because you'd still have that $525,000 being generated.
Kind of.
Spent on this purpose.
Kind of, but we will be losing funding from the backfill. So that has to also come from somewhere as well. So yes,
Yeah, I'm just trying to keep it in the
Mhm.
context though of just this issue right now.
in just this issue, yes.
Now you're doing 10. If you need to do 30, the net change is 20.
Correct.
That other things come in that are unrelated to this.
I would say yes, other than in order to move it all into the general sup, like what we would do to take this over, it would be the 30 cent impact because we cannot reduce general basic.
But you can use the 525,000
We could.
being generated now, basic, to cover. Don't have to do a full 30 cents. on some.
We could if it was available, yes.
If this was all that was happening in your world,
Yes.
just trying to actually look at the economic impact of this decision on the taxpayers, it's a net change of about 20 cents. It's not a
Correct.
30-cent change.
Sure.
And if I understand correctly, the idea the legislature has put forward on the taking away the backfill payments and stretching it out over 8 years is their theory is during that period, based on especially the urban counties like ours, tax base is going to grow. And so it really won't impact at 17 cents. Now, I'm not saying I accept that argument,
Sure.
but that is the legislative argument they made
Sure.
when they said we're going to reduce the backfill.
I don't know. I'm looking at your document from January 4th, Stella, that has the mental health levy at 0.39728, right?
Yes.
And that goes away to zero because of the change. So
Yes.
the state's taking over the full share
Yes.
of the mental health issues. So that levy dollars go away. It does seem to be that we would be able to, then that runs through, I know it's a separate levy, but that would give us an overall levy dollar amount. There is room to do, it's here, we could move that. Right?
Yes, you could. If there weren't all the other things going on. Yes. I mean,
Right, well, it's a puzzle and we'll have
Yes.
to figure it out, but it is the year to do this. If we're going to change a levy, because the rate to the taxpayer remains relatively neutral. That's how I look at it. And I think that's the discussion that Supervisor Potoff and I have had in our discussions. And Jay, you're shaking your head no, that we're wrong.
Well, it will not, because it will, as indicated, it will directly hit our general sub budget. And there will be someday, might not be the first year, a direct allocation for that related to a tax levy. And so the good news is we can afford this right now. City can afford it. Dubuque County can afford it. As I said, we've got good fund balances. So it's really not a question necessarily of can we afford it? So we can. I think both parties could afford to do it solo. City of Dubuque probably could afford to do it solo because it's a core service the government should provide. But I go back to, why don't we continue to partner and not raise taxes? That seems to be the solution that I would like to stay with. And so, you know, if you bring this to Dubuque County and Dubuque County solely has this responsibility, it will be a tax burden at some point. It depends what you mean by burden. I didn't say an increase, but it will be an expenditure that will hit our books at a much greater rate than today. At the same time, when I think many of our taxpayers were very pleased that the mental health levy was no longer on the property taxes and it was on the general fund of the state. So I just don't see really any merit of shifting it when it's going to be the same service that's running well now, potentially some management changes. But no, don't. I mean, there's a reason the city is asking this to be changed because it lessens their expense side, and that expense goes entirely on the county. That will occur if the change happens.
How do you suggest we make the taxation fair?
It's a good question, you know, and so City of Dubuque Police, you have sheriff office. City Police has a police department. They're double taxed too. Same way with Parks and Rec, along with our conservation. They both provide public spaces where people recreate and do park things. That occurs as well. And my thought is because it's needed. It's because the citizens in those communities say, I want that. I want you to answer the 911 call. I want the police department to be there. I want my parks department. And county, I'm happy if you have a sheriff's department and happy if you have a parks and rec department as well. So that's my vantage point. You know, they're core government services that, you know, and this is the very core. There are some citizens that argue with me on Parks and Rec and, you know, conservation, if that should be a core service, but it is today. And this is squarely one. And I am always going to lean to fund those and to support those. And so this would be a step in the wrong direction, in my vantage point. But it's okay to talk about it, and it's okay to change, I think, the formula, because the agreement is from 1970. So it does need to be changed. I'll give you that. I just wouldn't throw it all the way over from one government entity to another.
Okay.
Mr. Chair,
Yes, sir.
just one point is, even though you have a sheriff's department and we have a police department, you don't ask the city as an organization to contribute additional dollars to fund the sheriff's department. So you fund the sheriff's department by taxing all the citizens in the county, including the city residents, but you don't ask those city residents in addition to make a contribution to pay for it. So it's not the same as the double taxation that is happening with this center, because it is asked that the city of Dubuque makes a contribution, and that creates the double taxation.
Great.
Maybe I'll throw another point in. So, you know, a few years ago, and I had some comments about this, we decided to do a new 911 system throughout the county. And was that 12 million, 13 or 11? Berger?
10 to 11.
10 to 11. The county, and the county specifically debt service levy, absorbed all of that. The city's contribution generally was 0. And I voted for it in the end because we need it and it was core, but I made some of the same comments I did today, so hopefully I don't lose again. The county paid for entirely of that. So that is a financial burden that's lifted from the city. And if we change the 911 operations, that's another financial burden that's lifted from the city. And so then your property taxes go to what? Parks, art, streets, roads, probably those things. I just think the highest call of government is for that emergency response. And I'm happy to fund those. And I wish the city would be as well.
If I might, this really isn't about how the city puts together their budget. It isn't about the city of Dyersville putting together their budget. We let them do that because they're the city, they're their own incorporated entity. This is about providing the public good for the entire county, edge to edge, all citizens. What's the fair way to reckon that? How do we make that burden, that cost be shared fairly? That's what I've been asked to look at. I think that's what Supervisor Potter's been asked to look at. How do we do that fairly for everybody? And then let Luxembourg decide how they want to handle their own public safety issues inside their city. Each of our cities will be deciding that themselves, but how they pay for this service. And I think what we've not addressed is that there are some necessary changes to this service. We need to get the 28E agreement changed. We need to be looking at a place that we can have 911 services be able to be regionalized for a call center at some point. There are emerging needs for the public safety element here. And to continue to do that, we need to find a way to fund this that is fair to everyone. That's how I look at this. I'm not here because I'm trying to save people in the city of Dubuque money. I'm trying to make this work for an entire county. And it's been hanging in the 3 years that I've been a supervisor. It is a constant issue. Well, why do we do that? Well, we do that because that's kind of the way it once was, but it doesn't work anymore. It really doesn't work. It doesn't allow us to move forward. It's not allowing us to look at the right space we need, the right changes that we need. That's why I'm here. And that's why I appreciate, Mr. Van Milligan being here and Mark. I mean, we got to get around this. When you weren't at the budget session, when the sheriff presented, when Tom Berger presented, when Mark was presenting, I mean, we were all discussing the need to get a new 911 call center built, operational, get it out of the floodplain, make it be more responsive, more centrally located for the entire county. That's discussion that's been happening. This isn't something that, just generally came up. It's a need we need to be addressing. So I'm convinced we need to explore our budget. Stella, it's a puzzle. That's what you'll do. You'll give us advice and puzzle through that for us and find a way. We're not talking about increasing people's taxes or tax levies. We're talking about shifting the authority and the funding mechanism for this, but that the cities will have to figure out their own internal budgets as they do every year without our help.
One more.
Go ahead, Tom.
Just a little history too, we ran into trouble with the 911 surcharge in 2011, 2012, where we had to start replacing radios. We started replacing radios for the new system. And we came to the supervisors at that time because that was the only taxing authority that would make it so me living in Epworth and Joe living in the rural area and you living in Asbury pays equally. So, and that's how we were able to replace our radios to get to this part, to even do the whole system that we're on the county taxpayers as well. So with the debt levy. So, I mean, and the supervisors have always been supportive. So, I mean, we have a history of putting them projects countywide through, this is just now with the EMA levy or the EMA breakdown on the tax bill is an option for us. So.
Just to clarify too, as far as the any 28E that would be decided upon, and Tom, you can correct me if I'm mistaken here, but there's actually 3 parties that have to be satisfied on that 28E agreement. And only 2 of them are here in official capacity. Both myself and Tom and Mark, we may be speaking on behalf of the representatives of the 911 service board, but nothing has been voted on by that service board on whether or not they approve of either direction. So that's also something that would have to be passed by that board on how they also wanted to proceed with this. So just want everybody to keep that in mind, that regardless of what we decide here today, that we still have another component of this that has to be satisfied.
This was just basically designed to be the start of the conversation. I really wasn't expecting any decisions being made today, but we wanted to start the conversation to try to move things forward to get this straightened out.
If I might, Chair, if there's not a feeling that the third party to this agreement is interested in doing this, I mean, Sheriff, it's my understanding that there is significant interest from the third party to also make this change, that they see it as beneficial to their interest, to the public safety of the whole county. Can you say that's correct?
I personally, and I have not spoken to the individual members, and I believe that you have. So you probably know more about that than I do personally. And if you, but I cannot speak for the other members because I have not personally gone out and spoken to the sheriff, fire chief, and all these other.
We have discussed it at a fire chief's meeting, and it's, it's kind of the way they wanted to go. There were some issues brought up, that Mark is currently addressing and stuff. So I think the consensus of the fire chiefs is to move that way, but to have that official vote, I don't think the sheriff's right. We haven't.
Right.
As the 911 board.
And in my defense, I'm not a part of the fire chiefs meetings.
Yeah.
So if it's been discussed at the fire chiefs meetings, that's Tom has better understanding of that than I do. So.
Well, I think we should invite someone from that organization to represent and to give and to report back from the fire chiefs so that we have that party in the room as well in an official capacity.
Yeah, it'd actually be the 911 board, which is
right.
Most of the fire chiefs.
The majority of the people that I've spoken to are looking at it.
They know there's a change needed. They know that
Yeah.
Mark needs more space.
Right.
So.
And I think that's, I don't know that we're stressing that enough here, that it is because there's change needed. It's not just the fairness of that there is a need to make change, and that is coming in part from some of the fire chiefs, that they want to get this right in the time. It is time to make a change, to move 911 call center county central. I think there's a lot of factors that they'd like us to be having this conversation about. So
yeah, I mean, I think I think everybody agrees that this needs to happen, and how it's going to happen, is left up to really, I mean, the county board of supervisors and the city of Dubuque as the 2 main taxing bodies in the county. But yeah, I absolutely agree. I mean, I think if you go out and you talk to each individual fire chief, whether they believe in what happens with the 2080 or not, they're going to tell you that we need to do something about this.
Right.
So, I think that regardless of what we do here, that doesn't relieve us of the burden that something needs to change there.
Maybe I'm clear about the burden that needs to change. So if it is, occupying something in the floodplain, I get that. Okay. And so if that's the need, we still can address it. I have not heard from any citizens or other than insiders, and that'd be us that are right here that kind of manage these types of things and understand the taxation. No citizen or no city council member from any town, including City of Dubuque, has said, we need to change this. And so I don't see that need. I see it's an inside game. I see it's an inside tax allocation. I see it's an expense appropriation within governments. I get that. But I don't see from a citizen how this will improve their lot if we change the appropriations. I can tell you though, we've spent the last 5-6 years reducing the tax levy. And this change will do nothing but increase that. Maybe not first year, maybe not second year, but sometime in the future, it will change because it will catch up to us. We can't continue to absorb multi-million-dollar changes in our levy. The levy changes that I've been part of cumulatively from where we started are over 10 million. Probably in the same amount of time, those will all be erased. And my last point is what I said before. If we partner together, if the city of Dubuque and Dubuque County and all its residents partner together, those two governments, there won't be no change in the tax levy. Why not keep doing that?
I guess if you lived in the city and were paying 84% of this, instead of living in the county and paying 14%, you'd probably have a different aspect of it. But being you live in the county and you're only paying the 14%, it's great. I live in the county. I like that part too. But we have to be fair to everybody, Jay. The people in the city are county residents. They own property, they pay property taxes. That's the same way with the towers. It's on the county because everybody pays the same. It's fair. You can't double tax city residents for county services, Jay. That's not fair. We have to get a system down that is fair for everybody.
We have next steps.
We can schedule another
Otherwise, we're
meeting.
just exactly where we were for the last 3 years.
Right, I mean, just.
We
I
need
know-
to get,
I know Harley hasn't been, and I don't know if you've been here for any of these conversations in the past, but it seems like, just from my perspective, when we have these conversations, we have this conversation and then that's it. This is as far as it goes. So I think.
Right, that's why I
we
just
need to
asked for
have-
next steps.
Yeah, we need to, if,
Looks like you have the votes, so it looks like it's 2-1. So, you know,
well, I'm saying we need to,
not new, so that's fine.
we need to, I don't care if we have a monthly work session, regardless of how this funding works out. We need to probably have a monthly work session with this group and any additional people until we get this thing figured out. Because this 28E agreement thing, you know, as well as I do, you've been here the longest out of anybody on the board. We've been trying to deal with this for the last 5 years and we have not gotten anywhere on it. So until we get this thing straightened out, regardless of how the funding works, we need to continue having conversations on a regular basis, because otherwise this conversation is going to be done and we're going to be talking about it in 3 more years.
That's okay for me, because I think that's the fairest and bestest way to go. But I clear for my colleagues, they would like to go to a different direction. So
I would think we need to move with the 911 board, that you'd have their support on this. In the next meeting, if you get that on the agenda, then you would have that, I guess, answer. Next fire meeting would be something we could bring up to the fire chiefs, get, you know, a vote from them on how they would like to proceed with this. And once we get that information, then we can have another meeting with Mike here and discuss further.
Yeah, we can always pull together the 911 board and the fire chiefs. So let's, I mean, the fire chiefs really have a voice through Dan Neenan and Pat Ash on the public safety committee. So, but it'd be the 911 board we'd have to pull together, which isn't a big deal.
And then hopefully, like in another month, we'd have a little more information on the building space, you know.
Yeah.
Or
Are we anticipating making a change this year? I mean, we are all in our budget sessions. And I don't know how we can get a budget number for this year put together. I don't know that that's even possible.
I don't
mean,
know
the
that this is
city
gonna
has
move
to-
that fast, and I think this is something to probably, if there's going to be a change, I think it needs to be either worked on for next year's budget or the year after, or this is not gonna be a simple process.
Correct.
So I don't think I would anticipate any change for this year's budget, but probably something for the future, if anything happens.
It'd be pretty tough to have everything for the FY23 budget, I would think, but.
Would you agree with
I
that, Mike?
agree with you, but I think it's worth saying in public what kind of our timeline is. We're looking at getting this, as long as it all moves forward, this will be enacted for next tax year. Not fiscal year 23, we're looking at 24.
Well, and I think is your plan still to have the meetings on Mondays, the first Monday or every Monday yet? So I mean, there's chances for work sessions monthly or whatever.
Oh, right.
So we can keep everything moving.
Keep
Or
everything
even,
moving.
even if we could work it out where, you know, most of these, especially like these firefighters and a lot of the smaller town mayors have regular jobs. If we could work it out where we have it on the night meeting, you know, have 30 minutes of discussion at the 5:30 meeting at the end of the month, it might be something you might get more, a little better attendance that way. It's just a suggestion.
I'm not opposed to having a joint meeting during the fire chief's meeting, if that's helpful too, right? I bet we can ask one of our deputy auditors to come and take minutes, so we can have that meeting when it's just share an agenda item. Just think about that too.
Yeah.
Could make that work, yeah.
That's easy enough.
All right. Okay, well, we'll get something scheduled up and let everybody know. Thank you very much, Mike, for coming.
Thanks
Mark,
for the invitation.
Tom,
Appreciate it.
Joe.
Thank you all. Stay safe out there.
Thank you, Mike. I appreciate you.
Oh, yeah,
coming.
it's not, probably feels a little better.
Anyone need a break or anything?
I'm good. Thanks, Mike. Thanks, Mark.
We can move into our next work session. 10:30 with Auditor and DA Davidson and Company regarding the refunding of the county's 2014 general obligation bonds.
Good morning. This is Auditor Dragato. I have with us Nate Summers and Mike Maloney. They reached out to us a number of weeks ago regarding refunding our 2014 general obligation bonds. Seeing as how the vast majority of us were not here in 2014, we opted and they accepted to come and sort of do a high-level presentation of what the process is going to look like, what's expected of us and all the other parties. And with that, I would turn it over to Nate.
Thank you, Mr. Auditor. Appreciate it. Board, thank you for having us here for this work session. As Kevin mentioned, we just want to give everyone an overview of what we're looking at, what we're seeing in the market as far as cost savings for the joint agency. I and Michael Maloney, my colleague, have both worked with the county and with the agency for a number of years. I've primarily been the face for the county, and Michael's primarily worked with the agency. We have some joint action for the county to consider, and Michael will explain some of that in just a little bit, but we're looking at refinancing some debt that was issued in 2014 as general obligation bonds on behalf of the agency, and I'll turn it over to my colleague, Michael Maloney, to extrapolate on some of those savings.
Yeah, thank you, Nathan, and thank you to the county and the board members here for walking through this with us today. As Nathan mentioned, the county's part of a 28E arrangement for the solid waste agency. And while we will give you this overview today, no action is being asked of the board for this meeting, but the timeline that we provided would kick things off with action next week. I thought that would be important to point out today. So from a historical standpoint, and I appreciate some of you are aware of the context, but just to share that to make sure we're on the same page, this process started in 2014. And the key was the fact that the solid waste agency had some larger capital expenditures that would need to be financed. While the agency could conceivably issue debt on their own, it would be the highest cost of financing due to the type of debt and the agency's potential federal tax status. In reviewing with both the city and the county in 2014, it was arranged and decided that the county would be best suited to act as the conduit for any future debt issuance due to the size of the county's debt capacity and strong credit rating. With that in mind, we were able to take advantage of not just a higher credit quality, but some additional tax preference at the federal level and a small issuer exception because the county typically issues less than $10 million of debt in a given year. So with that in mind, in 2014 and subsequently in 2016, the agency issued bonds for their capital needs using the county as a conduit to the bond market. As part of that process, there's an agreement between the agency and the county whereby the agency is responsible not only for all costs associated with the transaction, but also the servicing and administrative costs for repaying any of the debt, principal and interest for the life of the bonds. The county is solely serving as an administrative agent for that process. We are looking at this time to refinance those original 2014 bonds with another issue through the county for the same goals and purposes from a cost savings standpoint. The refinancing is solely for interest cost savings, as June 1st is the earliest date that the agency's bonds can be retired. While we've seen some upward movement on interest rates, savings is still quite strong, nearly 2 times the industry standard for proceeding with this type of financing. So with that in mind, Nathan and I have both recommended that the agency and county pursue this opportunity, and we're now looking to start the administrative process with the county board. 2 items of note that were included in the memo provided as part of your packet. First, the steps we needed to go through in 2014 hold for the refinancing, but we will simply be amending some of those documentations in terms of the sharing agreement between the county and agency, whereby the agency repays all obligations. The one nuance that is different is it required the city's blessing back in 2014 and 16 for the issuance of new debt. With this solely being a refinancing issuance, the city does not have any active steps that need to be taken in the process, though subsequent to this meeting and board's expected action next week at both the county and agency, we will likely send correspondence to the city to make sure they are aware of the refinancing process proceeding. Plenty of content to start with there. I'm going to pause before covering some of the savings, reviewing the timeline briefly, and then we conclude from there to get you on with the rest of your day and meeting.
May I have a question?
Yes.
Go ahead, Ann, sorry.
Who is asking you to take this action? Who is asking you to issue refinancing?
Oh, the agency. It's a standard process when savings is there and it's able to be refinanced. So the agency is pursuing this refinancing.
So the agency approached you to do this?
We monitor both the agency and county's debt. Regularly, we're looking for any debt that can have potential savings associated with this. So this has been on the agency's radar for at least the last 2 years. It's just because of the date that you can redeem these early is not until June of this year, that there was no time to actually pursue this until now. And even at this point, we've got a very modest process from a timeline standard without having to rush. So this is the earliest time it was practicable to bring this to your attention. But yes, the agency's been monitoring this for some time.
And when we say the agency, that's really the city of Dubuque. So granted, Supervisor Potoff sits on that board, but the city of Dubuque manages the entire Dubuque Metropolitan Solid Waste Agency from operations to finance. Is that correct?
Yes.
Yeah, so it's the city of Dubuque has that request, which is it's a wise one from their vantage point. Very, very wise. Obviously, if you can get cheaper rates, that makes sense. But I would just remind the public that the role the county has in the Dubuque County Solid Waste Management Agency, from my vantage point, is very, very small. We have a board seat, but two of the other board members are city council members. All the operations, all the management, all the operation fees and revenue basically are processed through the city as a separate entity.
Correct. The landfill is self-sustaining.
But cash flows actually.
Yes.
Yeah, cash flows in the city of Dubuque.
Otherwise, the
management
county
fees
would
from
be
it.
paying taxes into that entity to keep it running because we are a partner in it.
Instead, the city gets the excess for their management fees. So
The landfill has the excess.
I'm sorry, Supervisor Potoff, what were you saying?
The landfill cash flows, so we don't put any tax money into it as the county, but the city doesn't either. They make enough money off of their tipping fees to be self-sustaining. The bond issue would save the landfill roughly 200 and some thousand. Wasn't that what it was?
Yep, it was a little above that in our projections for you. With the recent raise, is a little under that. Yep, that's the target, about $200,000.
And have you discussed it at your board meetings and you're aware of it?
Yes.
Okay, you don't have any issues that you're bringing to us?
No.
No, and Supervisor McDonough, Nate had reached out to Megan Boner and myself a number of months ago to let us know that this was coming down the pipe. So this has been something that they are sort of mandated to monitor. And as these savings make themselves present and are capable of being realized, then they reach out, and that's what we're doing here today.
So the question you hit on a little bit, just so why wouldn't the city just issue these bonds? Why doesn't the city do it themselves? They're a larger government agency than us. They manage it. They do all the finance, the operations. Why wouldn't the city do this?
So two reasons, and Supervisor Wickham, this is something we discussed, I think, both 6 and 8 years ago on these. So I'm not anything but the messenger here, but the context of that time was there are differences in the city and the county in the terms of the way they issue bonds and what that means. So specifically 2 things. One, from a credit rating standpoint, the county's tax base is larger than the city's. So you're going to have a strong credit rating, something that we've leveraged for county debt since that time. 14 was really the first recent issuance in modern history from that standpoint of scale. But the most important point, and the second point, was what I referenced earlier, was while the municipal issues through either the city or the county would be federally tax exempt, the county can enjoy a small issuer exemption in most calendar years. This is an additional tax benefit that the IRS gives to investors in bonds that lowers the interest cost passed through to the county and then in this case, to the agency. So because of that small issuer exception, the lowest cost of financing for this project for the agency was through the county rather than the city. And that was the decision on why that went that direction.
Okay, thank you.
Absolutely.
Good to hear we have a good credit rating, good bond rating.
Yep. And did you have anything further?
No, thank you.
You didn't want any action on this today, then you said?
This is solely setting the stage. Didn't want to force an issue down your throat for action today. We'll start the process next week with proceedings from your bond attorney, which is Dorsey and Whitney out of Des Moines. So we'll have those for your packet. Those will be provided, thank you, Kevin, to you for the next meeting. And then the public hearing will be the next process. As I mentioned, this is a pretty relaxed timeline. If the county had told us today that you needed money, we could probably put it in your coffers in about 6 weeks. And this has us taken a little over 3 months. So not trying to stress anybody out from a staff standpoint or a board agenda standpoint, just setting the stage. And Nathan and I will supplement this at each meeting, just letting you know we're checking off the steps. We've managed expectations with county staff on their time requirements, but are hoping the board's requirements are very modest for this purpose.
Okay, so you'll be on next week's meeting then? Okay, all right.
Yep.
Okay, Jay, you have anything further?
I guess maybe the last thing, it'd be nice to see our overall debt load that we currently have. If our finance director and or your organization can help that, and then maybe even compare it to the cities.
Sure.
I know theirs is quite larger, and so I can see why we have a better bond rating and can get better rates.
Nathan, that's something you can, I think we have that put together. We'll just prepare it for the next meeting.
Sure, I do. And I have it. I mean, I can share it with you right now just to give you a quick snapshot. Kevin, is it okay if I take over the screen?
I'm okay. I don't need the information now, but thank you.
Okay.
If the chair would
Sure.
like to dive into it, I'm good.
No, that's fine.
Okay. Yeah, we can share that for next week.
Okay. All right. Thank you, Nate. Thank you, Michael.
Thank you.
Thanks,
All
guys.
right, folks. You bet. Take care now.
Thank you, folks.
Goodbye.
Goodbye.
Want to move into the next one?
I will request a 5-minute recess.
Second.
Have a motion and a second for a 5-minute recess. All in favor signify by aye.
Aye.
Aye. We are in recess till 11:10. You ready? Call the Board of Supervisors back into session. Next work session will be to discuss the external ARP applications. I believe Ed has context on that.
Morning, Supervisor Butoff. This is Ed Raber, project coordinator for the county. I had a memo in the packet that again provided some background on what we're up to as a county, that some of the history of the various funding sources that this particular year the county has had at its disposal to program. And as you requested, you're starting to take a more focused view of the applications that were submitted by internally and externally, external partners, including for a variety of programs that you've already worked your way through, from mental health funding recommendations to the East Central Regional Board, to purchase of service that is a county program. So projects that either apply directly for the counties through their ARPA, through your ARPA portal for ARPA funds, as well as some applications that didn't receive all of their funding that they had requested through mental health or purchase of service. They're shown on this table that I've included here, put together with my colleagues. This table, you had requested to start looking at the external partners application in one of 4 different categories that the American Rescue Plan Act outlines as eligible: support for the public health response, address negative economic impacts, invest in water, sewer, and broadband infrastructure, and provide premium pay for essential workers. I'm sure you all remember that 2 weeks ago, the county, the supervisors, in discussing some of those, you took some action to set aside the 5 applications that came from external partners from a couple different things for those premium pay for essential workers. So the chart that's in here still shows those, but it shows that they were denied or have been set aside. So for today, what you had asked to look at for just a discussion purposes, you did not ask for, and so we don't have teed up any potential action items or resolutions waiting there for you, although we would certainly take whatever action you directed to us, so we await that. But the first chart that you had asked to look at is the support for public health response. So these are the applications that we've sort of categorized as generally self-categorized from the applicants for this category here. The amount that they applied for, you can see there's at least, there's one of these on here, the Dubuque Food Pantry, where since their application, they had a change, not in terms of what they're trying to accomplish, but with the venue or where that was going to be taking place. And so the dollar amount in there is actually a little bit smaller. And I've noted that under the notes column there, that they've shifted from a building next door to their current location to another nearby location. So trying to keep that all settled for you. Also, there's one application on here from St. Patrick's Catholic Church that is still listed that was related to food distribution. At some level, I think my colleagues here and the county attorney are unsure if the affiliation of that directly with the St. Patrick's Catholic Church is in compliance with what the American Rescue Plan outlines as who can get this money. But it's possible that if you really love the project, there's potentially a way to have another partner be the fiscal agent on that, with St. Patrick's Catholic Church as a distribution point for that. So do you have any questions as I've framed up this? No. again, as you start your own dialogue among you as a board, we await whatever discussion, or if you would like more information about any of these applications, or if you'd like to see a presentation or other materials in person, I'm happy to arrange whatever you'd like to do, or in the context in a larger way with any of the other applications. The memo shows all of the applications, including those from internal departments that have so far made applications. So that's the bigger context we offer. So thank you.
Okay, thank you, Ed. How would my colleagues like to proceed? Like to just kind of go through one section, see if we have any agreement, or if it's one that has no support, or one that we want to hear from? Or would you prefer to just go home and kind of do up a thing and then we come back and compare what we have and then move from there? Or
Yeah, I think we have very large requests from our own internal departments that all this funding there can easily be allocated to high need projects inside the county facilities. I mean, the HVAC system, the 911. There are a lot of high needs that all of this funding can be used for. I'd like to know if anybody has an urgent need that's got some kind of a timeline on it. Otherwise, I'm fine I'd like to get to the budget and start seeing what those numbers look like, because we might need to use some of the federal funding to offset literally expenses if the health department's going to be 3.5 times bigger, right? If the auditor has interest in a grant writer in their office. I think when we invite people in, as we have people sitting here today, there's an expectation that we're ready to take action, and I don't know that we're ready to do that.
I know there was some consensus on expanding the public health or the health department, but I'm not quite sure that it was to the extent of 3.5, doubling it. But I know we did a move to make the secretary full-time, and I think there was discussion on maybe 1 or 2. I don't know that we said 3, but that's neither here nor there. How would you like to?
Yeah. So this board agreed to get a public survey out there. We agreed to have an open application for external applicants, community providers. We did that back in April, May, I don't know, maybe June. We had a deadline for those applications in September. And generally speaking, they've been sitting since September. I don't think that's a good way to go about this. So I don't think we should put off those external applications, which we asked for. Okay, we asked for it. We said, give us your biggest and brightest ideas. We had all this discussion, and I was kind of a laggard on that. I was like, hey, maybe we should organize these, but we've done that. We've asked the public how they'd want these funds to be spent. They've responded. We have numerous applications that are in front of us here. So I think we should review the external applications, start with them, not the internal requests. I know they're valid and they're awesome, but that's what we do every day. Start with the external ones and get a list, and I've got a numbered list of mine of who we'd want interviews for. Not all of them we have to probably interview. Some of them look real good and you can read their application and you can make the decision. It's my vantage point. But I think there is a dozen or so, maybe a little less, that we should interview from the external. That's how I'd like to proceed in the near future. Obviously, yes, we have to finish our budget. That's going to happen. That's going to get done in the next 30 days. But in the next 60 days, let's start working on these external applications, which we requested.
It is a pandemic that we are not through yet, as evidenced by my wearing of a mask based on the CDC recommendations. We had that presentation this morning. So I do think that people who submitted an application many months ago understand that the pressing needs and the needs coming before the county have changed. Just last week, we invited the Dubuque County Library System to put forth a request with the city of Farley for a $3.5 million request for a new library. So things are still coming forward to us. And I say this with a raised voice because I'm talking through a mask. So that people get that things are constantly changing, and we're evaluating high priorities and where our commitments lie. I don't think people think we're just ignoring them because we just can't get it done. It really is about processing when is it time. If I have Teresa Caldwell, who's here today, thank you for all the work, tremendous work you do. You come forward and you make a 20-minute request, and then I still say to you, so sorry, we can't do anything to help you. Is that a good use of your time? Or would you rather be here when we're ready to make final decisions? I mean, that's what I'm asking. And Alex is here on behalf of the Community Foundation, and Kevin Schmidt was here earlier on behalf of his request for volunteer fire department recruitment. I mean, these are all large requests, which are wonderful, and they show the need, but time has changed for each of you as well. And that's what we expect as well, to see that positions have changed, responses have changed, funding has changed. So, you know, it's not that I want to ignore them, but I don't want to give an artificial reason to bring somebody in if we're just going to say, well, you know, all we have left is 10% of your initial request. There's got to be some work done here where we can say, you know, the first 12, agree everybody's read them, come with your, you know, how it might fit. We need to do a little bit more work, probably homework, to get ready before we start bringing in community leaders and asking them to put forward a presentation. That's where I am. And I don't think we're here. So if we're just gonna pick people, I'm gonna say, well, then what are we likely to tell Teresa Caldwell from the food pantry?
Well, that's why we do it in public, is that, you know, it's real time. And so, yeah, it is unknown. So
Right.
hopefully our votes and hopefully our decisions aren't baked. So yes, there is an element of surprise with the 3-person board because we do it in public. But I would have no intent to bring people in just to say, I have no interest in funding you or your application. So the intent would be genuine to say, thank you for the work you've done in your application, and here's our decision. And I think it's been enough time. Now, if we want a work session and talk about them beforehand, that's fine too. I just don't think we should have status quo, which is they just sit there. They've been sitting there. We've made a decision of no for a few, but the rest of them have not had public discussion or discourse. And, you know, it was September 15th. How many months is that?
It's quite a while. I'm not disputing that at all. And I'm sure several of them would like to have some information one way or the other. I mean, there's going to be several no's, and there's no getting around it. You know, nobody wants to be told no, but we can't fund them all. I mean, that's the bottom line. We don't have $66 million. It'd be great if we did. Maybe we can go back and ask Uncle Joe if he'll give us some more ARP funds. I don't know, but I doubt that'll happen. But there's going to be a lot of people who get told no, and some, you know, I've gone through the first part here, and I read applications and read applications until I had alphabet soup in my brain. But I was going through, and I kind of set a limit for that section. And I tried to affect as many people as possible, touch as many lives as I could by the ones I went through.
That's a criteria, touch as many lives as possible.
That's what I was trying to do.
Yep.
So I kind of came up with my list. I tried to stay under the $4 million, or sorry, for this section, I was at the total for the external. I had roughly 4 million. For this section, I had $1,431,000 that I came up
From
with.
external applications, because in here
That's
is
just
also,
external.
right, because we have all of, in this orange section, page 2 is, I guess those are internal. We're ignoring those right now.
No, because then you go into
There's
the negative economic
$31
impact.
million requests of internal applications. in
For
orange.
the negative economic impact, for that section, I had 1.9 million roughly, and for the invest in water and sewer at 660,000 roughly. That's for the external. I had 3,971,000. I was going by, it was 23% of the total ask for the external. So I just took what the total was and 23% and broke it down that way. That each section would get 23% of their ask, because their ask was 23% of the total of the external.
Do we want to go back, and folks that have already gotten funding from another source, do we want to, for instance,
I did not consider ones that had received funding.
so St. Mark Youth Enrichment, we've made a fund balance, we've allocated fund balance dollars to them. They also received purchase of services funding,
Which one was that answer?
St. Mark. We also entered into a purchase of services agreement with St. Mark. Is that correct, Ed? So perhaps St. Mark is complete in light of limited funding available.
I think the only one that I had chosen that had received some funding was the Hillcrest for the Access Me Care platform, because that was partially funded by the mental health fund balance. So I did have that down to complete that ask.
Right.
It was 236,000.
And that's a tough one, Harley, because the mental health region is not asking the state for all the millions of dollars that the state has offered to us. So the mental health region has access to more millions that they've said, no, we can't budget those anymore. We're not going to be able to take any more of that money. And at the meeting last week, I said, Dubuque County will take more, we'll take more. We can find very worthy projects to take more money that the state's offering. Nope, it didn't happen. The other counties are using cameras and technology in their jails for telehealth. There's just all these things that are happening in other counties, but we've spent our money away, which is brilliant. We've touched lots of lives. But to say that we should now give federal funding to people who requested more mental health assistance, I don't know, I just got problems with that. We're giving money back, and yet from our limited funds, now we're supposed to move forward. I don't know, how do you juggle that equity?
I don't know. I'd be more than happy to tell you what I had picked out if you just want to know that. I mean, and it's tough to pick and choose. I'm not gonna lie. You read them, you go back, you read this one, you read that one. But like I said, the Access Me Care to finish out what their ask was for that platform. Dubuque County Fair Association, I had those for 200,000 for the upgrades to the ballroom and everything. There's a lot of people that use it. Okay. Liberty Recovery, I did pick that. I think that will touch a lot of people, that it has some East Central region backing now, not as much as Ms. Mikulakis had asked for, but I put 200,000 a year for 2 years. It'd be 400,000. Dubuque Food Pantry was 200,000. Community Foundation, they had 3 different asks. I had just approved 2 of them, lines 18 and line 20 for 200,000. Salvation Army for 50,000, and Clark University for 145,000. Some of them are not totally funded. obviously, but to make it go as far as I could get it to go, we cut some down to add one more in or
Right.
whatever, but
And you know, and I'm still up at the very high level, right? We have 19. We don't have a request in yet from Field of Dreams. We all know that's coming. We know it's big. That takes it down by some amount. Farley Library, 3 million. That takes it down by some amount. Space needs for the county, millions. 911 center, that's 18 million if we dig. So when I look at high level and I say, are we even in a position where we can make these kinds of awards? That's where I am. So you can either look at it at the micro level and build up, and then say to the looming needs from the county edge to edge, well, we only have this left, so we divvy this up this way. That's where I am, where I just don't know that the highest need is for Clark University.
I
You
just
see what
trying
I'm
to
saying?
start something.
Yeah.
I totally
Right.
understand what you're saying.
Right.
And
So I think we got to get a better handle on when are these big asks coming? When are the big numbers coming in? And what does that look like? And what do we have left? What do we have? What is our budget shortfall that we should reimburse ourselves? Are we going to let that go? Are we not going to reimburse the county any of our own budget expenses that we did incur? This afternoon, we're going to get a request from Stella for another person in her department to just track ARPA money. Not just, I don't mean to slight that way. I don't, so don't interpret that, Stella. But that's another administrative expense that can come off this. We could be logging the time that we've spent the team and Ed Raber on doing these things, that those are reimbursable expenses. Are we doing that? Are we taking that? Or are we saying, nope, it's all gonna go out the door to nonprofits or to high needs? I don't know. So that's the point of having, that's the conversation I'd like to have my colleagues weigh in on.
Yeah, I generally agree with you, Supervisor Potoff. The things you mentioned, I would generally be in support of. So glad you went on a limb and mentioned those. So and I think that's what we need to do. We've asked the public for these applications. Are there others and other unknowns? Yes. Every day we come here on Monday, there's new things. So, but I believe the process that we've asked these people to abide by, it would be nice if we followed that. And so there'll be other applications, okay? But we asked this group to follow a set of rules. We spent a lot of time and energy on those rules, on the application, the staff did, on the application date, researching of, you know, what's eligible. And I think it's time. I don't think we have any, we're not going to receive any new information related to these applicants. And if we do, we'll be here another Monday. But I would agree with you, Supervisor Potoff. I would like to start talking about and or interviewing these applicants and make decisions. Not easy, but that's the process we asked for.
right, and a lot has changed since these applications have been asked for too. Obviously, Field of Dreams has a heavy lift. Farley just come in with their heavy lift. The building space needs, you know, kind of a heavy lift. So we do have to know what we have available. You know what I'm saying? Before we can, I think, kind of start calling people in, because if I can't afford you, I'm not going to waste your time. I mean,
You mentioned a 4 million handle, I'm in that range. So 4 to 5 million, I'm with you. So I think we have consensus. You know, there's certainly other views we can talk more about, but you know, I'm echoing what you said, okay? I'm more aligned to your process than the process Supervisor McDonough described.
Are you saying, Supervisor Wickham, that you're interested in funding external applications, the $4 to $5 million from the ones that we know here, or total complete with the ones that are not yet presented? Farley Library.
I'm interested in the external applications we have in front of us that followed the rules that we asked for to put the guidelines in, and they submitted their applications in September. I've wanted to go over these for months now. So I think it's time. I mean, it's what we asked for.
Well, I mean, I asked for big ideas, right? And one of the ideas is a dining hall dishwasher.
We did a survey and we asked the public. So there's different views of big
So, I
ideas.
mean, I think we gotta, my criteria is not the same as other people's criteria. There are other avenues to address private philanthropy. And every one of these applications that come before me, my question is going to be, what other grants have you submitted? What have you been successful in achieving? What is still lacking? And if you didn't apply for a grant from somebody else between September and now, how can you tell me it's still in need? So the passage of time kind of brings some things to percolation, right? Like, are we their only avenue for funding? And if so, why?
I was looking for those big ideas also. And until lately, there hasn't been a whole lot of big ideas that really jumped out and said, this is a great idea. I'm not gonna lie about it. Lately, there's been a couple that, yeah, this is a good idea and it is gonna benefit the county. I do agree with Jay that we should move forward some of these, if we 4 to 5 million, we get rid of the externals. And we'll know where we stand with the other ones coming in. I think, my personal opinion was 4 million for the externals. Jay's in at 4 to 5. I mean, can make that work. That still leaves, I think, enough funding where we know where we're at with the Field of Dreams project and with any other project, the bigger projects that if we want to support those or partially support or whatever.
I mean, I still am looking at this as, we asked our own departments to do this as well. And many of them have the ability to be budget relieving. Our own applications, the HVAC systems, there are things in here that could be done. Bottle fill stations, which were just approved and amended the budget. Things that are for our own workforce, our own employees that could benefit their lives. And we have never really fully addressed and tallied those things up. So I don't know that I have the $5 million to assist nonprofits in the external application. Not when I know that there's Farley Library coming. I mean, there are still things being identified. So are we spending all of our last dollars? Are we holding something back? I mean, this does get tricky. I understand new things happen every Monday, but folks are going to want to be treated equally and fairly.
I mean, would you like me to answer your question? I mean, we said
Please
$4 to
do.
$5 million, okay? The whole appropriation is 19.8. So clearly, we're not spending all of it. I've said external applications. Supervisor Potoff said the same thing. He said 4 million, I said 5 million. That's it. That's what we're talking about.
But this is, as you've said, the only time we get to have conversation in public. And so repeating the same thing, Supervisor Wickham, isn't bringing up further discussion points. It's
You said, are we
eliminating
really going to
discussion.
spend all of it? And so the answer is no, we're not.
We,
We're only looking at, I guess, on is the proposal with Supervisor Potoff and I agree on. And so I'm not sure if we're trying to convince you or we're just still in discussion, is we'd like to review the current applications that are in and make funding decisions in that general category.
last Monday, my colleagues moved $10 million, which we don't have, by the way. We have 9. You moved $10 million into our own county funding.
That we could pay these out of.
So that money, that $10 million is that could be used for this, and none of that is to remake our own budget. Is that right?
That money is to pay these out. These entities that we award, we can give them that money out of our account, and they don't have the guidelines like they do if it's under the federal guidelines. They'd be reporting to us, not the federal government. We're trying to make it easier for some of these nonprofits to report back to us instead of reporting to the federal government. That's why that money is transferred there. We can use that money as payroll, but the money's still there. We're using it to pay these. Correct, Stella?
So any revenue loss can be used for any county function. So we wouldn't be allocating it until the board decides. It is just kind of sitting there in that allocation until the board decides what you want to do with it. But it could certainly be used for anything like this.
But any money that we've expended for emergency management services, for face masks, for emergency relief, cleaning supplies, anything for the county, we could use that for public safety, right?
We could going forward. Much of those expenses were done through FEMA. So we wouldn't be able to double dip necessarily against this stuff.
CARES Act.
CARES Act, FEMA, HHS has come through with money for Sunnycrest directly. So a lot of those expenses have been paid, at least in portion.
So then do we have a budget shortfall at the county due to COVID?
Probably not.
No, that's,
We have a surplus.
stating, we have a surplus
We have more money in our funds than we ever have since I've been on this board.
because of the $19 million.
That's part of it, yes.
Yes.
So then we don't need to talk about making our budget whole because we don't have a budget loss.
So
sorry to come late to the party, but is that the answer?
The formula from the regulation for revenue loss made some assumptions that's how we calculated our revenue loss. When they came out with the final regulations, they said any governmental body, so this is everybody across the country, can take up to $10 million in revenue loss, which is most of, if you look at the smaller jurisdictions, they'll be taking maybe their whole allocation as revenue loss. That doesn't mean that it's just back into your fund balances. It still has to be spent. So we still must spend the money by 2024. 2026 in total. It has to be allocated by 2024, spent by 2026. So it doesn't get to just refund your fund balances. You still have to implement programs and items with it.
And did we find out how much our insurance costs have been that haven't been? So I asked when the insurance people were here 2 weeks ago, if they would get us a report about what has been the COVID costs in our insurance that we self-fund.
I
Did we
haven't
hear
seen
that?
yet.
No.
I don't know.
I have requested that. They said it will take a couple weeks because they have to go to Walmart to get the reports. So
So-
it has been requested.
Okay, and so we should have that soon.
Mhm.
And I am just trying to make sure that we have treated taxpayers fairly. They have sustained loss from tax revenue that we have taxed and received. And before we are out spending that money that we don't get more of, we need to make sure we've taken care of our own budget. Right? So we're back to square one. And this is the first I'm hearing that we don't believe we have anything that will be a budget shortfall unless we have medical claims. Is that correct, Stella? We do not have a budget short.
I will confirm with Megan. She has been the one tracking everything. She's not in the room. I was kind of looking for her, but we probably have been refunded most of our expenses directly through FEMA or CARES.
I guess I would have my colleagues try to come up with some of the externals. I just have the one section done. I got to do the other two sections yet, the economic impact and the invest in water and sewer. Like I said, I was at 4 million tops, Jay's at 5 million tops. I guess you come in wherever you would like, Ann, and we'll see if we can make that work. We can get done. I think we can get the external done Because these people need to have an answer because they have to have the money spent also in 2 years' time. So I think it's only fair. We've been sitting on it. We should move forward. That still should leave us enough money to cover any of the other larger lifts that we're gonna have coming up.
I would like to make one just clarifying statement.
Sorry.
I heard a couple of different numbers thrown out. It's 18.9 million is our total allocation.
I think I reversed them, didn't I? 19.8.
I just want to make sure we're all aware of the total number.
Thank you.
And-
We
and I
take
just-
4 off of that, we're still at 14 million.
We started a conversation this morning about 911, public safety being the high need for the county, to the point where we're going to reallocate potentially a tax authority. The funding that comes before us can be used for that.
Correct.
Correct. And so I don't understand the math that you're proposing. I don't, because I think that we're going to be faced with giving some of the folks the 10% of their request. Not necessarily saying it's highest need in the county, but thanks for participating. I don't want to give participation awards. And when I look at what we are becoming more aware of as time goes by, of the high needs that the county has that the funding can be used for, we owe it to the people that we intend to tax under our new levy. We're working on a budget right now, that we try to buy that down and to reduce their property taxes if we can by using federal funds. That's what I would say.
I'd agree with that. So yeah, definitely. Yeah, that's
said, I'm not-
definitely agree with that. Yeah, I think I know how long we're gonna spend on this, but I do have my list of 10, and you mentioned a few others in public. I'd like to disclose these, not necessarily with a behind the scenes list. And then start to review those, whether it's an interview or just us. That's where I'm ready to go.
You wanted everyone to be notified at Monday's meeting last week. I understood you to abstain from a vote because you felt people weren't notified we were making decisions about them. So if you are selecting 10 to come forward, then are the others no's?
No. That's just a start. So good question, but no, it's just a start. We will go through all of them, but we have to start somewhere. And this is the list that I would like to have more robust discussion on before we make a decision. The dishwasher, God bless them, or other ones, I probably don't need 15 minutes or half an hour of discussion. But we need to start somewhere. We've asked for these applications and I think it's time.
Do you have any ones that you're just ready to say no to?
Well, I'm
sorry, but somebody's got to be
50,
told no.
56, so I try not to fool people. Come on in here, I'd like to talk to you. I want to give you a big fat no. You have 30 minutes to listen to my no. So no, I don't really have it. So the list on my list here are people I would intend to have some sort of funding. But it's not an all and done list. It's a starting point. And so I'll mention it. So I would like to have the health providers, Mercy Finley in there. I'd like to have Main Street in. I'd like to have Historical Society come in. I'd like to have City of Bankston come in. I'd like to have Steeple Square along with the Maria Tyson come in. The labor harvest component, I'd like to have it come in. Labor recovery, which is Operation Empower, come in. SILT come in.
Oh, you're into
the EMS 5 come in, and then NICC as well. So that's my first start.
You were talking all 3 categories.
Right.
Yeah, I just went over, let's just let's try to get those scheduled in the next 30, 60 days, just to let the group, we're moving forward. We're starting with the process, reviewing it. No different than we start a process with budgets and we start with the department, or we started a process with the purchase of services. Doesn't mean that they're the chosen ones. It's just a starting point.
I would, I guess, think it may be easier just go by category at a time instead of all at once.
I'm an easy person. I'm okay with that too.
I just think it'd be easier to go just do the one category. Okay, and then we'll go to the public health and do that one, and then go into the negative economic impacts and do that one. I just think it'd be
I'm open to
easier.
that too.
What if we do with the 3 people who showed up today? Let's invite Kevin Schmidt back in. He's got a $700,000 request for volunteer recruitment. He's in the first category. Let's bring him in.
Yep,
Let's
it's
put him
my
on the
list.
agenda. Teresa Caldwell is here. She's got a request that's, I think, probably timely and urgent. Let's get her on the agenda. And she's in the first category. Alex Baum is here. He's probably got 2, 3, 4 things from the Community Foundation. He sits here as part of really the pulse of the community in many respects for the needs. So I would say, Alex, we'll work with you offline and bring you in. Those are the people who showed up to the meeting. Right?
Supervisor McDonough, we do have people voicing that they're
Excellent.
present
Let's
virtually. as well.
identify them. Who else is here?
We have Finley, Clark University, Mercy One, St. Mark's, Hillcrest Family Services.
I think it shows they're interested in having us discuss these and review them. So let's orderly start that. I mean, that's what Supervisor Pidoff and I have been saying for a half an hour now.
Kevin, do you want to read off who's here so we can get them on the list? Kevin, Ed, are you taking notes who we're inviting?
The list in the chat shows that Finley is present, Clark University is present, Mercy One is present, St. Mark's is present, Hillcrest Family Services, Operation Empower, and the Salvation Army. And if there is anybody else on Zoom who is present, please place it into the chat for us.
Thank you for attending. Appreciate your applications, and my intent is to review them shortly.
So should we have those
Chair, how
folks
would you
come
like
in?
to proceed?
Thank everybody for attending. I think we need to go individually, go home and you pick some funding mechanism for just the public health response section. We can get together and see who we want to speak to, or if we have consensus on. If all 3 of us have consensus on one, okay, we can move that forward to getting funded.
You bring that up. So if that's your intent, I will support it. So if we bring up the list of the support the public health respond external, I will say not all of them are perfectly categorized. That's fine. It's a new process, so I'm not going to beat anyone up. But if that's your intent, Supervisor Potter, I would like to move towards that list. So I believe we have consensus on that. If we want more discussion, so be it. But I'm happy to review that list at a future meetings. Doesn't have to be one meeting. We can look at over the, staff can coordinate these, we don't want to be here for, 15 hours a day, torturing people. So orderly and get the process done. And over the next 30, 60, 90 days, we'll be really far into it, if not done.
So I know, I don't want you to say I'm repeating myself, but I'm still unclear. Are all of those people coming in? Is that what you're saying by start on this list?
What I want you to do is come up with, like I did, basically, how much money would you spend?
I'm not going to do that.
Okay. That's fine. I have it done. If Jay wants it, then we can go through, like I said, if all 3 of us have the food pantry down, okay? We don't need to bring the food pantry in if all 3 of us agree that we want to fund that. That can move to the funding. If we go to the community foundation and there's differences, okay, we bring the community foundation in. Which one do you want to hear about? Do you want to hear about restorative strategies, or the child reads, or the book funding, Be a Healthy You? You want to read, you want to hear about all 3, or you just want to hear about one? Understand what I'm saying? At least we have some framework to who do we want to talk to, who do we need to talk to, and who we are not to talk to.
Yeah, I don't think we have that framework. We don't have a framework for that. You have selected several that you want to hear from. That's great. I don't understand why we're not listening to everybody at this point, because I think that's what Supervisor Wickham has asked. They be notified before we make a decision, yes or no about them. So don't we need to hear from everybody then?
That's not what I said. So
please clarify then, so I understand.
I just gave a list of 12. So that's about as clear as you can get.
So the folks who didn't make either of your lists, what will happen to them?
They will be reviewed after these. And every application, at least from my seat, I'm only one, will be reviewed, discussed in public, and given a decision.
And will they be on the agenda so they know?
That would be my preference, yes. That I did say. Yes, I'd like the things to be on the agenda so they know that we will review them. It might only be a decision, it might only be a few minutes. Others might take longer because they're more complex and have significance. I mean, it's very similar to what we've done with purchase of services, isn't it? It seems like not that different. It's very similar to what we do with departments. They come here and they have their proposals and we review them and make decisions.
What concerns me, and has for 3 years, is we approach this through the lens of philanthropy. This is what the McDonough Foundation does, reads every one of them and says, oh, this is here, what do you think? We are supposed to be leading a pandemic recovery, and it isn't about which one do we kind of like and who do we not like. It should be based on priorities and strategic need. And that's not what we're doing. We're going to give consolation prizes to folks for participating, because we don't know why we want to hear from one and not another. I know that's hard work too, but this isn't philanthropy. We need to pick projects that have merit and strategic purpose.
And that's my intent. So that's my intent. And I'd like to get started on that intent.
And we can hear from everybody. It's gonna take time.
We asked for this process. We asked for this
We asked for
process. We asked to
no issue
submit your
with
applications. Give us your ideas.
listening to
Provided
everybody.
applications. We didn't tell everyone that we would be responding to each and every one of them, other than, I mean, people write grants all the time and they get back a response that's form.
Not how I do business. Everyone, we asked for their application. We're gonna review it. I'll discuss it with them, hopefully with my colleagues in public. That's my intent. And then we'll make funding decisions. Not everyone will get funded, correct? Some will be no, some will be zero. And that will be the outcome. And then we'll move on to internal. And then we'll eventually move on to additional priorities that are starting to bubble and circulate up.
So if, obviously it sounds as though there's consensus to hear from everyone on the board. Or everyone that has applied,
Okay, let's hear from everyone who's applied.
just in the support the public health response. There's one, two,
Let's start at the top alphabetically.
we have Clark University, Community Foundation, Dubuque County Fair Association. Be able to do 4 a day, you think? Or
I would, I mean, we have good staff that helps us organize and prepare and time frequency and invite people, the public. You guys do that real well between.
Regarding
auditor's
that
office.
great staff, I think you meant to say great, not good.
What did I say? Good?
Regarding that great staff, I think what we're looking for is exceptional. Yes, I've heard that. I think what we need is just direction. We sent out a survey to each supervisor. Part of this was to avoid having to have 20 groups come in and present if there are common threads. If all of you want to fund the food pantry to X amount of dollars, then I don't know why the food pantry has to come in here and do a tap dance for that money if the 3 supervisors intend to fund that project.
Project has changed.
I understand that. That's what
That's a
that's
great
what the
example.
group, that's what the work group,
Monday, that's a great example, actually.
that's what the work group has asked from the beginning, though, is to get direction from each individual supervisor so we can identify commonalities to simplify this process. And to date, we've received that information from one supervisor, Chair Potoff.
Your commonalities that you've asked for are financial dollars. Those are not commonalities. Those are not strategic purposes. They're not evaluations of they're just breaking out money and putting money in.
We actually didn't ask for dollar amounts, even if you could just give us organizations that that the 3 of you value and that you see as serving a public purpose, as you see.
Right, and then that becomes that it's not on the agenda, that they're not all being heard. So I don't know how to hear from everybody and make sure everybody is touched without starting at the beginning and going down the list.
Supervisor Potoff, I'm not sure if you still have your original intent of reviewing the external applicants that are in front of us. That's where I'm at. I don't know how much more discussion you would like, but I don't seem to be gaining more new information. I would like to start reviewing the list that at least this moment you and I have agreed on. I'm not sure if Supervisor McDonough has agreed on that process, but thought I heard you correctly. That's where you wanted to start.
I thought we.
That's where I would like to start.
But, and would like to hear from everybody, I guess. I don't have an issue with that either. We got to start someplace. So I say, let's start at the top. We'll start with Clark University. Have staff set up 4 people, 15 minutes a piece. That'd be an hour. If you do Clark, the Community Foundation, the fair, and Dubuque County firefighters, that'd be 4. Or like maybe next Monday, or 2 weeks, whatever would work.
I think with publishing deadlines and notification for some of those presentations, we would have to have everything in by Wednesday afternoon. So that gives them 2 days.
So go out one more week.
Yeah, we'll be fine. Next, are we 60, 90 days? Just let's keep moving. I mean, you'd start sooner rather than later, but this process will take us a series of meetings. So
It's going to take.
our great staff is exceptional at doing this.
Does that give you a direction on which way to go?
Can we assume that if one of those first 4 can't attend, we can go to the 5th person?
Go to the next person. Make sure you have at least 4
Good with that.
set up. We'll see how it goes the first week and the first time we do it, and maybe next time we can have more, or we'll see what the timing actually is. Okay. Everybody's good on where we're at, correct?
It's a good problem to have.
And you're good?
We don't often get this funding from the federal government and being able to implement these projects. So I'm very excited about it and appreciate my colleagues muddling through it, but it looks like we have a way forward.
All right. We'll move forward. Boards, commissions, and supervisors update. Have anything?
For the purpose of time, there's nothing more pressing.
I'm sorry, speak up.
For purposes of time, there's nothing pressing there for me to share that. I can share next week.
Do you have anything, Jay? Or?
Oh, I am good as well.
All right, and we'll just move. See, we have a work session with Don Sherman regarding collective bargaining. It would be a closed session for the purpose of discussing strategy for upcoming labor negotiations with the county's organized employees pursuant to Iowa Code Section 20.17 parentheses 3.
Motion to recess or what?
Yes.
I'll make a motion to recess for 5 minutes.
Second.
Have a motion and a second to recess for 5 minutes. So we go into closed session. All in favor signify by aye.
Aye.
Aye. We are in recess for 5 minutes.